Joni left us a question on YouTube. She said, is there an adult RSV, an adult version of RSV? If so, what are the signs and symptoms? What are the treatments? Are there long-term side effects of RSV?
So RSV, Respiratory Syncytial Virus, it's found in all ages. There's an abundance of pathogens that can cause the common cold or common cold symptoms, and RSV is one of them.
Okay.
So the most basic answer is that there's no adult version, there's no kids version. While there are two main subtypes, there's no actual difference in what virus you might be contracting, whether you're an adult or you're, an infant.
So it's not like chicken pox where there's more an adult
more
or child
in that
version.
case.
It's one issue, one virus. That's a virus.
Right.
But yes,
the genotyping of the virus is, well beyond the scope of answering this question.
Sure.
But again, for all intents and purposes, there's A and B. It seemingly varies which one is the predominant type by season. But again, there's, I couldn't really get a clear signal on, whether A is more serious for kids or more serious in preterm infants or, in 65 plus. I don't think there's a strong signal there. So again, it's just, kind of segues us into more of her question. But in general, what happens is there are just higher risk groups in the population. So because we hear about it often in infants and how severe it can be in infants and in children under 2, let's say, it's just, we assume, it must not be a big issue in adults, but it certainly is a virus that, especially if you're in one of these higher risk groups, which we'll talk about, it can have pretty serious implications.
Okay. So what are the signs and symptoms? Is it just the same as a standard cold for most people?
For the most part, yes. So you'll see fatigue, cough, sore throat. I actually have a lingering cough right now. So could potentially have been a little bit of an RSV exposure at some point, but fatigue, cough, sore throat, congestion, runny nose, headache, fever even. And now with more severe infections, they're often characterized by worsening or worsened versions of those sort of symptoms. So you'll hear somebody's cough not get worse, you'll hear somebody's cough continue to get worse.
Okay.
And then it's often accompanied by wheezing, especially in, young children. You might see that shortness of breath, higher fever, persistent fever, and even a bluish tint of the skin. So you often see this manifest just by the nature of where the virus colonizes, that you'll see these more severe progressions into lower respiratory tract infections even. So,
okay. So it is a thing, and it is potentially dangerous, but primarily for people with weakened immune systems. Yeah.
And so I think to highlight some of those examples might be useful, I think, just to kind of crystallize those a bit more. Yeah. So we mentioned infants, especially preterm infants. Children under 2 are greatly affected by this. And so actually, as a caveat, RSV is actually America's leading cause of hospitalization in children under 5 years old.
Oh, wow.
So it is quite widespread.
Okay.
Yeah.
I remember seeing somewhere that most kids, like a solid majority, 70, 80% of children have had RSV by the time they're 2.
Yeah.
But that for most kids, it's a cold functionally, and nobody knows the difference.
Yeah. I would say that's accurate.
But for some, it does get very serious and they end up being hospitalized.
Yeah. And I don't want to lose sight of some of these other higher risk groups. So just to kind of finalize that. Of course, the elderly is greatly affected by this. Usually anyone over 65 years old might want to just be a little more concerned, especially if you have these certain chronic conditions. So COPD, asthma, again, things that greatly affect
respiratory.
Got it. We have congestive heart failure, coronary artery disease. So things that as they pertain to cardiovascular health, as you mentioned, the immunocompromised population. So maybe individuals who are currently on chemo or have had an organ transplant. Any of those, that sort of umbrella. And also kidney and liver disorders are implicated here, diabetes, and then also neurological and neuromuscular conditions as well.
Interesting.
Plus the usual, frailty with older age is something to consider when a provider is looking at, more of a risk situation, especially if you're a candidate for a vaccination, which we'll talk about. And then also the last one would be those residing in long-term care facilities or nursing facilities.
Makes sense.
Where things it's super contagious.
Yeah.
I don't want to lose that. It is very contagious, but as you mentioned, it just doesn't always cause the most dire of side effects, dire of symptoms.
So what are the treatments if somebody has it and it's progressing past your standard cold symptoms?
So for your average adult, your average person, there are no specific treatments for RSV.
Chicken soup and rest.
Yeah. So for a lot of people, you'll see complete resolution of symptoms within 1 to 2 weeks.
Okay.
This is kind of the cut point. And as I mentioned, I do have a little bit of a lingering cough. This is one of those that you might see a cough extend past that 1 to 2 week time frame. And then more supportive care, symptom management, all the usual things that we would recommend for the common cold. So fluids, you might want to use some saline nasal spray, as the congestion can get pretty rough. Throat lozenges, medicated ones that can soothe your throat if you're coughing a lot. Decongestants, ibuprofen, acetaminophen, your usual
all the usual
cold
suspects.
and flu remedies.
Yeah.
Definitely.
Okay, so that's treatment for it. You mentioned a vaccine.
Mm-hmm.
Is that prevention? Is there something beyond vaccine? Tell me about that.
So as of this past summer, actually, there were 2 vaccines that were approved. So summer of 2023, we saw the emergence of 2 vaccines, one from GSK and one from Pfizer, I believe. So we have RSV and we have Abrisvo.
I'm so glad to let you butcher some names.
I mean, it's so insane.
Sounds like a duo.
It does not make any.
They do sound like a duo.
They're made by marketing teams and not for people that have to say these things often. So
yeah, I'm sure they should be required to bring that team out to talk about, all right, this is where we came up with this name. They have some deep meaning behind it. At least maybe we can get behind it.
You ask them and they're like, ChatGPT.
That's honestly,
yeah.
AI came up with this for us.
We tested it.
We put letters that can go together, but they don't go the best together.
Right.
But it still works technically.
We looked for URLs that were available and we bought the one that made the most sense.
Yes.
So we've got these 2 vaccines as of summer 2023.
Mm-hmm. So specifically, it was approved in those that are 60 years and older.
Okay.
So it makes sense just given that higher risk groups that we alluded to.
Yeah.
And actually, at this point, they're saying that the protection lasts for about 2 seasons.
Oh, wow.
So I think as we get through this season in particular, there will be an abundance of information, I think, still yet to be discussed. But I found that interesting. You might, and it's certainly, I think, from month to month, you see some waning
right
in the protection of it. But in general, to have that potential is a nice thing.
And you said seasonally. So is it just standard cold and flu season, like late fall all the way through winter into early spring is when we need to worry about it?
Yep.
Okay.
Exactly. Yeah. Pretty easy one to remember. And so a lot of people are getting this now, at least what we have seen. A lot of people are getting it with their flu shot. People they've come in together to get both of those. Mm-hmm. Now there are looking at what the CDC recommends, it's sometimes hard to get people back in for different immunizations. So just doing them on the same day is fine. But in some of these clinical trials with the 2 vaccines that we mentioned, there is the risk for, a potentiation of some of those unpleasant side effects that they go away, but you have the potential to feel sore or crappy, especially doing those together.
Makes sense.
And to that end, they have been generally well tolerated so far. Just the general adverse effects from immunization, soreness at the site, fatigue, etc. Now, there is a small chance for some neurological side effects that I think that I've found interesting. There were some cases of Guillain-Barré reported. Now,
That's the one where like part of your face goes numb and can't function, correct?
Yeah, it can be pretty devastating. Some people fully recover. Others, there's, permanent paralysis, God forbid. Again, a very small percentage, but something to note. There were some other neurological issues as well with it. But again, I stress it's just a very low percentage of the participants. And again, we'll have more of that data as this is more widely used. There also was a small potential for triggering atrial fibrillation, especially if you already have AFib.
Right.
Again, a very low percentage it appeared, but still worth mentioning in that same vein.
Yeah.
So in addition to 60-year-olds and older being candidates for this vaccine, the Abrysvo specifically, that one was actually approved in pregnant individuals weeks 32 through 36. The thought is that, actually what they found is that immunity is passed on to the newborn through 6 months of age. So we have actually seen some of that as well. So if you fall within a certain, gestational age, then you're also a candidate if you want to confer some of that immunity onto to the newborn baby. A very at-risk population. So this sort of thing is progressing. I think what the CDC is even recommending at this point is not just that everybody 60 and older should get this or consider it.
Right.
It's that everyone over 60 years old, they're candidates, and with shared decision-making with your provider, you can decide, with your pharmacist or your doctor, you can decide if this is a good option for you.
Right.
So I think that that's that accurately encompasses my thought on it as well. It's certainly not for everybody.
Right.
But if you find yourself in a high risk situation, we know the common cold can sometimes be a little worse than that.
Absolutely.
So,
absolutely.
And the other thing I wanted to mention, around the same time as the other vaccines, an injectable monoclonal antibody was also approved. This was approved to prevent serious lung disease caused by RSV.
Oh, wow.
And this was specifically in babies under 1 year old or entering their first RSV season, or children up to 24 months of age who remain at risk of severe disease through their second season.
And this was a preventative. Mm-hmm. It was not because I know
not a treatment.
Yeah, monoclonal antibodies were used as treatment for COVID and something else recently. But
they're used across the board for many different autoimmune conditions.
Okay. And
so my understanding is that they almost consider them long-acting monoclonal antibodies. So
wow.
They help the body produce the necessary antibodies, of course. Probably be a little bit out of my area of comfort to even distinguish this from the immunizations themselves. It's interesting. It's an interesting way that they developed this. There's no doubt. So there's two of those actually. The original one that came out, it was Synagis, I believe.
Okay.
That was another monoclonal antibody, but you had to give it monthly.
Oh, wow.
And so was used a little more under specific circumstances.
Yeah, high-risk individuals, I would think.
Yeah, and it seems like something that you don't have to give every month would be more desirable. But I think more and more people are concerned, again, with this. Okay, if I have a newborn and they do have RSV, even if their infection doesn't progress terribly,
right,
does this leave them at risk for these other things?
Yeah.
Which will kind of takes us into the next, the final part of the question.
Yeah. What are the side effects of RSV long term?
Mm-hmm. This is a contentious topic, in my opinion, at this point. There's a lot that's still being, I think, uncovered. Mm-hmm. And so as we see more with how individuals responded to the vaccine over these couple seasons, that will be useful. But in general, epidemiological data suggests that RSV in the first 3 years of life is associated with long-term respiratory morbidity, such as recurrent wheezing and asthma, decreased lung function, and possibly allergic sensitization. It's unclear whether RSV and lower respiratory tract infections cause wheezing, or if any genetic predisposition or other environmental risk factors increase the likelihood for an exaggerated response. But again, the observational, the epidemiologic data is there to say that there's
something.
There's something.
Yeah.
So I will say I'll just leave it at that. There's something there. There's more prospective data that needs to come out. But as far as any other major, like long RSV, how we hear that in other contexts,
right?
I'm not so sure that that's the way that they're looking at this one, at least right now. It's just more or less these breathing issues that sometimes manifest with an allergy component or, whatever else. So I think that it accurately encompasses it.
Yeah. So long term, it doesn't seem like for the most part that's the case, but there are select circumstances. All right. Joni.
That was a big one.
That was a big one. Joni, I hope that helps. Big answer to a question. Hopefully it helped a lot of other people too, because that has been a popular conversation on the internet these days.
Yeah.